All right, today we're jumping into something that sounds like it's straight out of a sci-fi movie, but it's happening right now, using AI to predict when you might get sick. We're going to break down a really cool new systematic review that pieces together all the latest research, and it shows us just how much of a game changer this technology really is. So, really think about this for a second. What if your doctor could actually predict an illness before you even felt sick? I mean, instead of you dragging yourself to the clinic with symptoms, an algorithm quietly flags a potential issue weeks, maybe even months ahead of time. And look, this isn't science fiction anymore. This is the central, incredible promise of predictive AI in healthcare. And believe me, this isn't just some fringe idea. The research in this space is absolutely exploding. I mean, just look at this chart. The number of studies has just skyrocketed. And it's all thanks to this massive flood of data we now have, from things like electronic health records, and of course, the new tech that can actually make sense of it all. So, with that in mind, let's get into the big idea behind all this excitement. Okay, so here's the big picture. What AI really promises is a fundamental shift in how we even think about medicine. We're talking about moving from a reactive model to a proactive one. You know, for pretty much all of history, medicine has been reactive, right? You get sick, then you go to the doctor, then you get treatment. Proactive healthcare completely flips that on its head. It's all about using data and these powerful predictive models to figure out who's at risk and then stepping in before the illness can even get a foothold. It's a total mindset shift from cure to prevention. And this isn't just theoretical stuff. It's already being used in some of the most high-stakes situations you can imagine. We're talking about AI models that can predict deadly sepsis in the ICU, forecast who might have a heart attack, spot cancer risks early, and even help overwhelmed emergency rooms figure out who needs help right now. It's incredible just how versatile these tools are becoming. So that all sounds great, but it naturally leads to the next big question. How does this stuff actually work? What's going on under the hood? Well, let's open up the digital doctor's bag and take a peek at the models and the data that are making all of this possible. Okay, what this table makes really clear is that there's no single magic AI for medicine. It's all about matching the right tool to the right task. So for something like critical care, where you've got lots of neat, structured data from patient records, models like XGBoost are the star players. But when you need to analyze something messy and complex, like medical images for heart disease or combing through genomic data for cancer, that's where the heavy-duty pattern recognition of deep learning really shines. So we can kind of boil all of this down to two main camps. On one side, you have your tree-based models like XGBoost. Think of them as the specialists for clean, organized data, all the numbers and tables you'd find in a patient's electronic health record. And on the other side, you've got deep learning. These are the experts at finding hidden patterns in messy, unstructured data, stuff like MRI scans or the continuous stream of data from a heart rate monitor. But here's the thing. You can have the fanciest model in the world, but it's totally useless without the right data. And this leads to a huge dilemma in the field. See, researchers love using public data sets, like this one called Mimic, because it lets everyone compare their results fairly. But there's a catch. A model that's trained on patients from, say, a hospital in Boston might completely fall flat when you try to use it on patients in, say, rural Texas. It's this constant battle between creating reproducible science and building tools that actually work in the real messy world. All right, so if this tech is so promising and the research is just taking off, you have to ask, why isn't predictive AI in every single hospital today? Well, it turns out there's some pretty big hurdles to clear, and this review breaks them down into four main categories. So let's walk through these. First up, you've got the data and generalization ability problem, basically making sure a model works everywhere, not just where it was built. Second, the famous black box problem. Can a doctor really trust a prediction if they can't understand how the AI came up with it? Third is clinical integration. I mean, how do you actually fit these tools into the already chaotic daily routine of a hospital? And finally, wrapping around all of this are the massive questions of privacy and ethics. And this quote right here, it just nails the black box problem. Think about it. Doctors spend their entire careers learning the why behind a diagnosis. So if some AI model just spits out a risk score with zero explanation, how can you expect them to trust it? Especially when we're talking about high-stakes life-or-death decisions. It really all comes down to this. Without understanding, there's no trust. And believe me, the real-world complications don't stop there. For one, most of these models are tested on historical data, which is way different from being tested in a live, unpredictable hospital setting. A lot of the time, they're built in a vacuum, with no feedback from the actual doctors and nurses who are supposed to use them. And this last one is huge. If the data used to train the AI has biases in it, say it underrepresents certain communities, then the model itself could end up reinforcing those same health disparities. That's a massive risk. Okay, so we've laid out some pretty big challenges, but it's not all doom and gloom. The good news is researchers are already hard at work on the solutions. They're focused on building the next generation of AI systems, ones that are truly trustworthy. So what's in the pipeline? And what's cool is that each of these solutions is designed to tackle a specific hurdle we just talked about. So to fight the black box problem, we've got explainable AI, or XAI, which is all about making models transparent. For the privacy issue, there's something called federated learning. To make the tech more accessible, there are automated platforms, and to make sure it actually gets used, the focus is on seamless integration right into the existing hospital workflow. I want to zero in on federated learning for a second because it's a seriously clever way to get around the privacy roadblock. Instead of forcing hospitals to pool all their sensitive patient data together in one giant vulnerable database, the model does the traveling. It goes from hospital to hospital, learning from the data on site. The raw data never ever leaves its source, but the lessons learned, the insights, are shared. It's a way to have your cake and eat it too. Collaboration without sacrificing privacy. So, when you pull it all together, what this review really shows us is that the future of AI in medicine isn't just about building more powerful algorithms. Honestly, the algorithms are already getting scary smart. The real challenge, the human challenge, is building systems that we can trust. Systems that are transparent, ethical, and actually fit into how doctors work. Because at the end of the day, the algorithms are getting smarter. The real challenge is making them trustworthy.